Hi, I'm Dr. Soltero. Welcome to our next in our series of videos. Today we're going to be talking about the abdominoplasty, or what's commonly known as the tummy tuck. A lot of patients come usually in the winter to fall time, sometimes in the spring, looking for what's usually considered kind of that tightening, that to get rid of that extra tissue that they have around the abdomen. They had a few children. Some patients actually have had massive weight loss after lap banding or gastric bypass. Basically, the reality is they have tissue that they have either tried to lose or it's just redundant and cannot be taken away. The best option for this is what's usually referred to as the abdominoplasty or the tummy tuck. What it entails is a scar that's placed on the bikini line. The tissue that's redundant, it's removed. We also at the same time tighten the abdominal muscles, putting a series of stitches that are placed on the actual fascia, which is almost like a cloth-like fabric that sits right on top of the muscle. That creates an internal corset and reinforces that abdomen. The beauty of it is that you probably will never have to do sit-ups again for the rest of your life. Now, once that tissue is removed, you're absolutely flat. And the beauty of it is that all that clothes that you had put away that you thought, I'll never wear that again, now it might even fit you or might even be too loose on you. A lot of times this procedure is performed together with some liposuction, in which we sculpture your body, giving you a better waist, taking some fats from other parts of the body. Now, patients usually ask me how long it's going to take, how much time before I can go back to work. The idea is really you need to give yourself a little bit of time, about usually 2 weeks to recover from this procedure. If you ever had a C-section, patients that had that procedure and then eventually had a tummy tuck tell me that the pain for the tummy tuck is less than the C-section, about a 20 to a 30% less. For patients that are really worried about discomfort, we use a variety of tools to try to make it as comfortable for you as possible. There is the use of what we call a pain pump that helps to minimize the discomfort in those areas. You should plan at least a couple of weeks off work to recuperate from this procedure. Surgery time, we're looking at about 2 to 3 hours, depending on the magnitude and how much work needs to be done to perform the result that you're looking for. I perform the procedure in a certified facility in which we use board-certified anesthesiologists to give you the highest level of security. Now, in reality, a lot of patients that either come from out of town or are from other parts of the country will either send me pictures via email, or if you're in town or you happen to live in the San Diego area, just stop by the office. We'll take a look at you and give you what are the best options for you. Some patients also combine these procedures with other procedures such as breast augmentation and other things, and we can talk that in the future a little bit more. Please stay in tune. We'll see a couple of pre- and post-operative pictures so you can see some of the results of the work that I perform in some patients. Thank you for spending some time with me, and I'll see you soon.